All right, welcome back. A normal aging process is the menopause that takes place in females, and we diagnose menopause when menses has ceased for an entire year. So some people will have disturbance in the regular menses, irregular menses, for in some cases few years before the actual menopause. So if a person had an interruption in the regular menses for 3 months, for example, we don't consider this as menopause. We need to wait for an entire year without having any menses. There is no equivalent to menopause in males, remember, because the mitotic division here of the spermatogonia is going to be taking place all the time. This allows males to produce an unlimited number of sperms throughout their life after puberty. So for the first question for the in-class activity for today, what phase of the uterine cycle is the uterus developing in response to estrogen? If you remember, the very first thing that develops, it's the proliferation of the endometrium, and we call the proliferation here of the endometrium, it's my proliferative phase. This is what takes place under the effect of estrogen. The main reason for all these symptoms of menopause is going to be the decline in the estrogen levels. Decline in the estrogen levels is going to result in atrophy of the reproductive organs and breasts. Also, this will be associated in some people with irritability and depression, hot flushes of the skin because of the skin blood vessels going to be undergoing vasodilation, because the estrogen normally is going to be acting as a vasoconstrictor. So when I have a decline in the levels of estrogen, this is going to result in dilation of the vessels in the skin, gradual thinning of the hair, skin, and also bone loss. Females are protected from developing coronary artery disease, strokes, because estrogen keeps the cholesterol levels in the blood very low. The risk for those diseases starts to rise after menopause due to the decline in the estrogen levels. Another 5 stars diagram here is showing the cut section of the breast. As you see on here, the breast is going to be formed by mammary glands surrounded by adipose connective tissue. Mammary glands, those are modified sweat glands that will be releasing milk. They are arranged into lobules. Each lobule going to be conducting the milk through a duct. We call this the lactiferous duct. And if you look closer, towards the end of each duct, we've got a bulging part. This is where we store the milk. Oxytocin here acts to contract those pouches to squeeze the milk out through the openings of the ducts in the nipple. We call those bulging sites, those are the lactiferous sinuses. So again, looking here, this is one of the mammary glands. It's located inside a lobule. Each of the mammary glands is going to have a lactiferous sinus. which is a bulging part of the lactiferous duct. Each lactiferous duct opens by a separate opening in the nipple through which the milk is going to be released. Around the nipple, we've got here a dark skin surrounding the nipple. We call this as the areola. We'll see the breast is located in front of a large muscle in the chest. We call this as my pectoralis major muscle. Breast cancer usually arises from the epithelium of the small ducts. Risk factors associated with breast cancer includes early onset of menstruation and late menopause, no pregnancies or pregnancy late in life, first pregnancy late in life, family history, especially a mother or a sister, is going to be a high risk factor for developing breast cancer. So how do you explain early onset of menstruation or late menopause are going to be considered risk factors for breast cancer? What do you think? Why early onset and late menopause going to be risk factors for developing breast cancer? So if I ask you the question, what is the most common reason for divorce? Single most common reason for divorce? Money? Anyone else? Differences, no children, money, money. Any other ideas? Sex life? So the single most common reason for divorce is the marriage. Without marriage, there will be no divorce. All right, this is the same concept on here. All right, so here I've got early menses and late menopause. So during this time on here, I'm producing estrogen. So if, for example, first menstrual cycle rather than coming at age of 14, let's say, it started at age of 8. And menopause rather than taking place by age 45, took place by age 55. So rather than 15 and 45. So what is the fertility period for a person who got her first menses by age 15 and her menopause by age 45? The fertility period, it's 30 years. So her breast is getting exposed to estrogen for 30 years, compared to the other female that got her first menses earlier in life. Let's say, for simplification of the numbers, say 10. Her first menses was by 10 years of age, and she got late menopause by age 55. So she had a fertility period for how long? 45 years. So she got an extra 15 years of being exposed to estrogen. Because remember, each month, what is going on in the ovary? Follicles are growing, and those follicles which are growing are releasing estrogen. And the estrogen is actually enhancing and enlarging the development of the breast. So having early menstruation and late menopause means I am a female for a longer time. I have been a female for 45 years rather than being a female for 30 years. I mean by being a female means I have a fertility period for 45 years or 30 years. All right, so estrogen here, estrogen is gonna be affecting the breast for a longer time. This is the same concept. So what is the most common reason for divorce? It's marriage. So if who has the lowest risk for developing breast cancer? What do you think? Not being a female, being a male. So males will have a much lower risk because they do have very low estrogen levels. All right, does this make sense? So not being a female in the first place is going to be reducing the risk of developing breast cancer. All right. 2 genes that we were able to identify that are directly related to the development of breast cancers. Those are breast cancer gene 1, breast cancer gene 2, or BRCA1, BRCA2. And those are going to be responsible for around 10% of the number of breast cancers. And the presence of those defective genes will make a female perform a preventive mastectomy. So she will remove her breast before the development of a breast cancer because she has a very high risk of developing breast cancer due to the presence of those hereditary defects. 70% of women with breast cancer have no known risk factors. So none of the above will be applied to them, and they still gonna be developing breast cancer. So all those risk factors that we've mentioned are only gonna be associated with breast cancers in 30% of the number of breast cancer patients. Early detection by self-examination is not recommended anymore. What is currently recommended, it's to perform regular mammography. Self-examination is not recommended anymore. Treatment depends upon the characteristics of the lesion, according to which type of cancer has been developed. What is the metastasis of this cancer? Did this cancer reach the lymph nodes? Is this only localized in one quadrant of the breast? Is this occupying 2 quadrants? Did it metastasize to the bone? Did it metastasize to the lungs? And so on. So the treatment depends mainly on the characteristics of the lesion. And the management of the breast cancer patient will widely vary according to the progress of the disease. But we still going to be managing all patients with three main ways, which are the radiation, the chemotherapy, and the surgical removal. Those are our three main ways by which we're going to be managing almost every cancer patient. See on here a normal breast on a mammogram, and this is a breast showing malignancy occupying, you see on here, this lobule. It started to invade the surrounding tissues on here. Moving on to the sexually transmitted diseases, or the STDs. The single most important cause for reproductive disorders is going to be the sexually transmitted diseases. It might be due to a bacterial infection like gonorrheal infection, syphilis, chlamydia. It might be viral infections like the genital warts and the genital herpes. Starting with the gonorrhea usually affects the mucosa of the reproductive and urinary tract. It spreads by contact with the genital, anal, or pharyngeal mucous membranes. In males, it's going to be represented by urethritis, which is the inflammation of the urethra, painful micturition, and discharge of pus. So here, what's coming out of the penis is the pus, bacteria and dead neutrophils. Problem here with females infected with gonorrhea is that 20% of the infected females are not going to be showing any signs or symptoms of infection. So they will be infective to their partners, but they are not showing any signs or symptoms for the infection. A major problem associated with the gonorrheal infection is the development of what we call the pelvic inflammatory disease. And the pelvic inflammatory disease is simply an inflammation, accumulation of pus everywhere inside the endometrial cavity and the fallopian tubes. And this is a very important cause of sterility, infertility. Because how do I heal an inflammation is by forming fibrous tissue. So it's like having an inflammation in my skin. It heals by forming a scar. So it's the same exact concept when we're dealing with inflammation inside the endometrium. So inside the endometrium and the fallopian tubes, I might be developing some bands, or that will result in constrictions of the fallopian tubes, preventing the sperms from reaching the ovulated egg. For those who will develop symptoms, usually symptoms are going to be in the form of abdominal discomfort, vaginal discharge, similar to the ones that we've seen in males, pus, abnormal uterine bleeding, usually reported as irregular menses. So when a female gets an infection, she goes to the gynecologist thinking that the blood she is seeing, it's the menstrual blood flow. But most likely it's going to be due to the infection. So when we check for the reason for irregular menses, most likely it's going to be an infection in the uh, reproductive tract rather than a hormonal disturbance. And this explains why some people will say, yeah, I've got menses during pregnancy. All right, so what she got actually is an infection that caused bleeding. And she reports this as if it was a menses during pregnancy. A person cannot have menses during pregnancy. Remember, if fertilization of the egg took place, what's going to happen? The corpus luteum will remain in the ovary and there will be no shedding of the endometrium. All right, so most likely females who are reporting menstrual blood flow during pregnancy, this gonna be an ongoing reproductive tract infection. Moving on to syphilis. Syphilis is a bacterial infection transmitted sexually and can be contracted congenitally. So the mother can pass it to her fetus. Infected fetuses are stillborn or die shortly after birth. So if a female has syphilis and she is pregnant, the baby might die during pregnancy, so the baby is born dead or dies shortly after birth. What is the problem with syphilis? The problem with syphilis is that it starts by a painless chancre, an ulcer, as you see on here, and this ulcer heals on its own. It disappears within a few weeks. So if a person got this chancre and he got busy with life and he didn't go to the doctors to check it out, and it disappears within a few weeks, so he will not actually seek any medical treatment. So this primary syphilis can progress into secondary syphilis. And this is another problem, that the secondary syphilis here doesn't have any major characteristic symptoms. So it is going to be showing pink skin rash, fever, joint pain, as if you've got a cold or flu. All right, so something that is not that specific. So also the patient will not be seeking treatment at this point. And this what can progress into a latent syphilis or tertiary syphilis. And the tertiary syphilis actually gonna be breaking down everything. So this is a statue of a person here who developed tertiary syphilis. You see major destruction of the bones, major destruction of the nervous system, skin, blood vessels, everything gonna be affected by the syphilis as it progresses to its tertiary stage. Treatment, it's relatively easy. Penicillin, it's a very widely used antibiotic. Moving on to the chlamydia, and the chlamydia is the most common bacterial STD in the United States. It's going to be responsible for 25 to 50% of all diagnosed cases of pelvic inflammatory disease. Again, pelvic inflammatory disease, we've got inflammation, pus accumulation within the endometrial cavity and the fallopian tubes. Symptoms include urethritis, penile and vaginal discharge, abdominal, rectal, and testicular pain, painful intercourse, and irregular menses. So actually, irregular menses is simply bleeding. that will be falsely reported as irregular menses. So the chlamydia does not affect the ovarian hormonal cycles. Right? What happens here is simply bleeding due to the irritation of the mucosa that will be mistakenly reported as irregular menses. It can cause arthritis, inflammation of the joints, urinary tract infections, and can result in infertility and sterility in females. Again, why sterility in females? Pelvic inflammatory disease is characterized by having inflammations that heals by fibrosis. So if this is a fallopian tube like this, those are the fimbriae that will pick up the ovulated egg. This is the ampulla where the fertilization of the egg is going to be taking place. And I have inflammation on here that healed by fibrosis. So if a sperm is trying to reach the ovulated egg in here, it won't be capable to pass through the obstruction of the fallopian tubes. That's why in females, it's a very, it can develop sterility. Treatment is with an antibiotic we call tetracycline. Tetracycline is the antibiotic of choice for treatment of chlamydia. Genital warts, it's caused by a virus called the human papilloma virus. It's the second most common STD in the US. It's mandatory now in all 50 states for females to get a vaccine for the human papilloma virus because it carries a risk of developing cervical carcinoma. And that's why people are going to be performing pap smears. So why do we perform pap smear? Pap smear is simply getting cells from the cervix and check them under the microscope to make sure that there is no pre-malignancy in the cervix. Most common reason for cervical carcinoma is actually the human papilloma virus or the genital warts. Genital herpes, you see on here, very similar to the herpes infections that develops around the oral orifice. All right, so the one that will be affecting the face, body, it's called the herpes virus type 1. The virus that affects the genital organs is going to be herpes virus type 2. Herpes virus is going to be characterized by latent periods and flare-ups. So it disappears and then reappears and then disappears and then reappears. Congenital herpes can cause malformations of the fetus. That's why it's recommended to check for any herpes infection for pregnant women. Treatment will be acyclovir, which is a very common antiviral drug that we use. And it's going to be the drug of choice for treatment of the genital herpes. Questions? All right, so this completes our discussion for today. Any questions related to the exams, lecture exam, live exam, quizzes, assignments? We've got only one in-class question today. All right, so thank you so much for making it to the meeting today, and we'll see you all on Monday. Yeah, lab question. Yes, you can. For the rest of you who don't have any questions, uh, please please write your first last name in the chatting box, and you're gonna be good to go. Thank you so much, and stay safe. And we'll see you all on Wednesday. For those who have questions, please write your question down for me to be able to check it out in the chatting box. So for Christian, I'm not sure what you're asking about. So she left her lab question for fem and mask. I still don't understand.